Oh, we're crazy, right? Okay, yeah, okay, that's perfect, perfect. Okay, we're starting. Okay, let's do this. Let's do this. Wait, 5, 4, 3,
So much background.
2, 1, and welcome to another episode of the Mid-Level Show. The mid-levels of performance medicine are bringing it to you every week about what Dr. Rogers wants to talk about. Isn't that kind of the plight of the mid-levels too? Whatever the doctor wants to talk about. I want to talk about coffee. Why don't we talk about that? I just had
Let's talk
3
about
cups.
coffee.
Yeah, let's just change it up a little bit and talk about what we want to talk about. I'm kidding. We're talking about the prostate today. So the prostate and prostate health and PSA, which I think is a very important topic. Dr. Rogers mentions in the note a lot of hesitancy when coming into an exam because they're going to bring up the prostate exam. And everyone knows that the way to palpate a prostate is going rectally through a digital rectal exam. I do think it's important to note, too, whenever he's saying this, anatomically, when we look at the prostate, where it sits in the body for males, I say that like females, it sits differently. Males have prostates, females do not have prostates. We'll put that out there. To palpate and to feel a prostate, we're only feeling the posterior portion of the prostate, which I believe is 1/3 of the actual size of the prostate. The rest is anterior on the other side. So what are we feeling for? We're feeling for an enlargement and we're feeling for nodules, because we don't want prostate cancer. Now, he also mentions here too, most people die with and not from prostate cancers. I just would love to know, do you find the hesitancy, the nervousness whenever we talk about prostates with males? Do you ever get the, no, this is kind of what I get. Hey, like, have you had any changes in prostate health, which is going to be changes in urination, like you're going to be a weak stream, I'm peeing 1,000 times during the middle of the night. And I'll always ask like this, hey, so how's any changes in prostate doing well? Oh, no, I'm good. No, well, everything's good down there. No need to check. I get that all the time. Do you guys find that in the rooms as well? Cara, how about you? Cara's our nurse practitioner in Knoxville. What do you think?
We usually ask, when was the last time you had your
It's a better way to
prostate
phrase it.
examined? But actually, men are very concerned about their PSA. I mean, I might talk about liver, kidney, whatever in the labs, and it's what was my PSA. So they're very concerned about that. But I also try to stress the importance of an actual manual exam and how important that not just labs, but a manual exam of the prostate is. So usually we'll just kind of check in, and then we'll ask specifics like, you getting up at night to go to the bathroom, you have any history of prostatitis, so more specific things. But yeah, I usually ask that, and that's usually, oh yeah, I just had that done.
2 seconds ago, I literally just no need to do it again today. You don't want to have it too many times. It's not a painful exam, but it's an uncomfortable exam. But you're right. Most people and most patients are concerned about that number, the PSA, the prostate specific antigen. We're doing a public service announcement about prostate specific antigen. Dr. Rogers talks about in the notes this magical number of 4 or less. When you get those labs back looks fine. It was within normal range. But he also too talks about the velocity, the how fast is PSA changing. Fran, any thoughts on velocity versus total PSA, and even too, I had to look this up before coming into the note. Free PSA is unbound PSA. High free PSA is less indication of cancers. Any thoughts on kind of the lab values?
He said it was actually protective,
right,
to have a high free PSA. Yeah, I think it's very interesting that it's not about one lab test that you get. He mentioned the things that can raise it, that it might not actually be high, like lifting weights or having sex too close to your exam or being on a bicycle. So I thought, if you get a PSA back and you're not happy with the result, it's something, get another one. Don't just base it on, and make sure you're doing everything correct to make sure you're getting a good value.
Absolutely.
But tracking it is important. And he even said, I think he said he had people with PSAs as high as 18.
that
without
didn't
cancers.
have cancer.
Yeah.
So just because you have a high PSA, don't automatically think I definitely have cancer.
Absolutely.
Look into some other things, get it checked out. He mentioned even that MRI, which I thought was very interesting. If I was going to have a biopsy, I'd much rather have something where you was less invasive and they got right to the prostate.
Yeah, the
You know,
MRI guided biopsy is I think it's the way to go. You're getting the picture and you're getting the full picture without blind sticks. So without the MRI guided biopsy, you're doing blind sticks at the prostate and taking samples. With MRI, you can see where there's those cellular changes so that you can target where you're taking the actual sample from. There's only a few places that do it. I believe he mentioned Knoxville. There's a great guy, Dr. Bush, that was out of Chattanooga, now is in Atlanta, that we referred to quite a bit, too, because prostate's an important. It is a weird walnut-sized organ, but it's a very important process for the male sex life. It provides lubrication to the sperm, and through ejaculation, it provides fluids. So a lot of the times, men don't want to have their prostate removed unless it needs to be removed. If it's full of cancer, yes, that's pros and cons. But there's a little bit of a like, hey, this is part of my anatomy, I don't want to take it away. It provides a benefit to the ejaculatory process. But you're right, Fran. Recheck it. Recheck and get another value. And I never even thought I never thought free PSA. So unbound PSA means that it's not sticking to, because prostate-specific antigen, yes, specific to the prostate, but can be elevated through activity, through riding a bike, even too with benign prostatic hyperplasia, BPH. That just means you got a big prostate. So you're going to have more antigen coming off of it from a big prostate, which you can feel through a prostate exam. So I think it's important to recheck. Too, I had some other thoughts about prostate too. This is kind of maybe not a little bit off topic, but with the LGBT community, with the transgender community, I actually read across a study I think it was a week or two ago. I think it's important that if you do come across patients who are transgender, who have gone even through lower half surgeries, you still have a prostate from male to female. You still have that organ. It's still there. So it's still important to check. So I feel like it was a real big eye opener to me. You think, yes, for the transgender population, we're manipulating hormones so that we're getting the correct hormones through gender identity. And two, surgically, we look more of the gender that you identify with. You're shaving down the Adam's apple, you're doing top surgery to have breasts, and you're doing bottom surgery to change the genitalia, but the prostate is still there. That's something they don't often remove. So something I learned from this that can be a take home for viewers, but also if you're a mid-level practitioner listening to this, I think it is really important how we phrase things so that when a transgender female patient comes in for maybe a routine visit, we're not gynecology, but they come in through gynecological visits for their female woman exam. The prostate still has to be examined to make sure that there's not changes there. So making sure you're checking the lab value and also phrasing it as a lower half exam, a bottom half exam, so that you don't have to say, hey, we need to check your prostate. Hey, we're doing this as part of your lower half exam. That really was eye-opening to me. I don't know if have y'all come across any studies with that? That's very specific, but I thought it was something that I thought was important to include.
I have not seen any, but I know OBGYN 40 and over, they automatically do a rectal exam.
Perfect, right.
And a lot of times that's a good time to get a hemocult card at the same time and just go ahead and develop that and get some answers then. So,
and two,
depending on their age.
He mentions in the note too about rectal. It's a screening for rectal cancers as well. Cellular changes that have a mass in the rectum, which is you're getting a 2-for-1 bonus out of that exam too. That's good to know. So over 40, that comes standard. Perfect. And two, that makes sense too. With men, we're saying over 40, that's when we should start doing yearly prostate exams with PSAs. So really too, he talks, I want to know what y'all think about the naturals he talks about, things that we can incorporate in our diet. Fran, any ideas of there's saw palmetto, there's stinging nettle, which I didn't know too much about stinging nettle. I knew saw palmetto, pumpkin seed, any of the naturals that you find beneficial?
Well, zinc, he mentioned that one too. And and most of the men that come through are on zinc because we recommend that. When we have them on testosterone. Most of them are already on that. But yeah, the pumpkin seeds, and I think you said boron?
And boron was new to me too.
Yeah.
Yeah, these are all stuff to check out.
But anything you can take to prevent, and I'm sure there's got to be a combination nutraceutical that's for prostate health.
Right.
In fact, we might even have one in the office that I'm unaware of.
We need to check.
Life Extension. Life Extension makes one.
They do. Okay. So they make a specific one that's kind of has a lot of the different. That's good to know. Come by Performance Medicine and or go to Life Extension. We use Life Extension vitamins and love them. The thing I like, this is a public service announcement about vitamins. Life Extension's great, and that's what we sell in the office. It's because we see on lab values where you'll see lab values improve, especially with vitamin D is my biggest one. If you check a vitamin D, it's low, and you're replacing with something that isn't USDA verified to have what's supposed to be in there, the vitamin D comes back and it's not higher than it was. With Life Extension vitamins, I've seen it be low, you replace and it comes up. So you just know that you can trust that brand. So that's something good. For me, I'm all about naturals, and it seems like zinc is kind of like it's like the one that you can take for everything. And tadalafil too. I'm surprised he didn't talk about tadalafil in this. Tadalafil can actually sometimes help with the size of the prostate. Have you all heard that? Cara, have you heard? I think we might have mentioned that in our tadalafil talk.
And it's also good vasculature, as we talked about in one of our previous shows, with Raynaud's and some other uses for tadalafil. But yes, it can help that too. Yes.
Yeah. Well, listen, I think this one was this was to the point. Is there anything else we're missing? We're talking, I feel like really I encourage you, men over 40, get your prostate checked. Don't be scared at the exam. Don't be scared of a number that comes back abnormal. Fran, you made a great point about rechecking and checking all your options too. And we didn't specifically get into the prostate cancers with Gleason scores, but it's something I don't want viewers and listeners to get too worried about. I always say you cross bridges once you get to them. I will say too, there's a great book called Testosterone for Life, which we've advocated in previous programs as well. It's a kind of a starter book that we use as providers coming into performance medicine on how we replace testosterone, because there is this huge kind of thought concept that testosterone is going to cause heart disease or it's going to cause prostate cancer. And that book goes into the studies that they use for that. And they're just old studies. They're old studies with 4 participants that said it causes prostate cancer. So do you all ever get that in the room? I do get that question quite a bit that, hey, is this going to cause prostate cancer? Do you all get that?
Yes, we have before.
That book specifically, I can't think of the author's name. He's a physician out of Cambridge that taught from Harvard and has I don't want to say a low T clinic because it's not the brand low T, but he's got that's great information that it does not actually cause prostate cancer. The way that testosterone can maybe affect the prostate is if testosterone converts into dihydrotestosterone, which can make the prostate grow. So there's blockers from testosterone to dihydrotestosterone like finasteride that help with the size, but not specifically with prostate cancer. But any other closing thoughts?
On that book,
yes.
I'll give you the author. It's Abraham Morgenthaler.
Okay, Morgan.
Morgan. It's I don't know. It's right here in our suggested reading list.
Yes.
Have it.
Yes, it's awesome. You can put it on Amazon. It's the first thing. It has 2 people riding a bike on the front, and it's awesome. I'm telling you, it's a great read. It's an easy read, but it really gives some great evidence for why we replace with testosterone, but also calm some of those fears or those common misconceptions about testosterone therapy. But I just want to keep talking about the prostate. I mean, who doesn't want to talk about the prostate? Females, I'm so sorry you're left out of this conversation. you do not have a prostate, and that is fine. You have enough to deal with on your plate, so we don't want to add anything else to that. Any closing thoughts, Cara? Any closing thoughts for maybe some of our listeners or viewers that are wanting to come in and get their prostate checked?
Just regular checkups and follow up, and testosterone does not cause cancer.
Yeah, that's great. I like it. That's a PSA. Public service announcement. Got it. Okay, Fran, any closing thoughts?
I liked her closing thoughts. They were perfect.
That's perfect. And two, we don't have our sister in crime. We don't have Amber here today. She's at the beach and enjoying herself, getting tan. I know that she was itching to talk about the prostate too. I mean, listen, we text about the prostate all the time. I know that this is what the one she wanted to be a part of, so we'll have to make sure we mention it next time in our next mid-level show. We'll just kind of do a quick recap so she can give her thoughts. But anyways, thank you to Fran and to Cara. Thank you for tuning in and listening, and join us next week as we talk more medicine. I'm excited.
All right.
Thank you all. I appreciate it. I'll see y'all.
Day.
You too.
Okay. All right. Bye-bye.
Bye.